Hey guys, welcome back, and today we are going to see another nursing care plan, and this nursing care plan you can use for depression, schizophrenia, anxiety disorder and any other mental illness which is related to imbalanced nutrition. So the nursing diagnosis is risk for imbalanced nutrition, less than body requirement related to self-care deficit or self-care neglect or refusal for self-care. So now the nursing care plan. So you can divide the column like this, same like in every video how I'm explaining. Assessments, diagnosis, planning, rational, implementation and evaluation. These are all the steps of your nursing care plan. So under assessment, what you will write? You will write subjective data and objective data. What is the subjective data here? So what the patient says about the condition, that is subjective data. And what is the subjective data here? Patient says that he or she is not feeling hungry and not liking to take the food. He or she is not interested to eat the food, and she is not or he is not feeling hungry. So like that is the subjective data. Or what is the subjective data is always depend upon your patient. So what is subjective data? What your patient is saying about the condition. So after observing, you can ask some questions to your patient, so the patients will tell, I'm not feeling hungry or I'm not interested to eat food. Whatever the patient saying, that you have to write under subjective data. Then what is objective data? After the discussion or after the conversation, what you have observed from the current situation. So that is called objective data. So you can write what you have observed from the situation. So here I have just written patient looks dull and tired. Obviously, if the patient is not feeling hungry, what will happen? The patients will not eat food. If the patient is not eating, followed by that, what will happen? The dullness will occur, tiredness will occur. So this is the common thing you can write in all imbalanced nutrition nursing care plan and diagnosis. Objective data, patient looks dull and tired. So assessment column, so we have done subjective data, what the patient says about the condition. Second, objective data, what you have observed from the present conversation, okay, or from the case sheet, what you have observed. Then we are going to the diagnosis column. Under diagnosis column, what you have to write? You have to write the diagnosis and also the goal. What is your goal from this particular nursing care plan? So what is the diagnosis here? Risk for imbalanced nutrition, less than body requirement related to self-care neglect. And what is the goal? The patient will consume adequate nutrition and maintain adequate weight. Okay, or the patient will maintain energy, and the patient will start to perform the daily day-to-day activities. So like that you can write the goal. Then while coming to the planning session, you are writing all the plans what you're supposed to implement. First and foremost thing is history collection, physical examination. That is a common point where you can add in all the nursing care plan, because without history collection, physical examination, you cannot continue or you cannot do anything, because you should understand what is your patient, what is your patient's condition, who is your patient, what is the present situation of the patient. So without thinking, first planning is do history collection and physical examination. For what? To understand the general condition of the patient. So after planning, you have to write rational, then you have to write implementation, and last you have to write evaluation. So do history collection and physical examination. For what? To understand what is the rational, to understand the general condition of the patient. Then implementation, you can write done history collection and physical examination, means after completing that. Then second planning is complete a thorough nutrition screening. That is very very important. Instead of writing some theoretical things, if you have some real evidence like nutritional history of the patient, what is the present nutritional status of the patient, you can plan based on that. So you have to go for a complete thorough nutrition screening. So these information you can get from your case sheet, or from your from your nurse manager, or from the particular department. Okay, so complete thorough nutrition screening. So you can write second thing, complete thorough nutrition screening. So you will get these informations, okay, and with the support of your colleagues and nurses and the person or the doctors or dietitian, from their report you can collect that information. Then what is the rationale? To understand the patient's nutritional status. Then in implementation, you can write done nutritional screening, okay, or collected the information from the nutritional screening history. like that you can write. Then assess the reasons for imbalanced nutrition. That's very very important. Reason will be different for different patient. Okay, if it is because of depression, the reason will be different. If it is because of schizophrenia, means the reason will be different. Sometimes olfactory hallucinations, or maybe they will feel some other kind of taste in their mouth while eating food. So you should understand what is the reason behind this imbalanced nutrition. Then after that you can write the rationale to prioritize the plan of action. So based on the reason only you can what prioritize, or you can make the plan of action. Then in the implementation column you can write assess the reason, and you can write the reason in your implementation column. Then next planning is assess the patient's eating pattern. That's very very important, how they are eating. Either the particular patient is a binge eater, or eating a lot at a time, or not eating and some very like what finger food eating. So what type of eating pattern they are maintaining, or eating only chips or crisps kind of things, and no other carbs, or eating only liquid food. So you have to assess the eating pattern of the patient. You can collect the information from the patient, also from the nutritional history. Okay, there will be a diet chart for every patient, and so you can collect the information from that. For what? To plan the nutritional diet based on their interest. Then assess the eating pattern. So that is the implementation. And you can write what you have assessed. The patient is taking liquid diet, the patient is taking semi-solid diet, the patient is taking only finger food, the patient is not taking any nutritious, the patient is taking only water, whatever. Okay, so what you have observed, that you can write there. The next planning is check the patient's food choice. That is also very important. Okay, so what type of food they are interested, okay, in which type of food they are showing more interest. So if they are interested in some particular kind of food, means you can what make them to follow that diet to improve their nutritional balance. Then for what why we have to do this check, means to improve the calorie intake. And in the implementation column you can write check the patient's food choice, or found out the patient's food choice. Then assess the patient's perspectives and feeling towards eating and food. That's very important, because the patient might be from a different culture compared to your culture. Patient's religion will be different from the what hospitals or the patient's other patient's religion. Sometimes the patient will not eat a particular type of food. So it's very important to understand the perspective of patient, and especially in psychiatric conditions like depression or schizophrenia, they have different perspectives of food. So assess the patient's perspectives and feeling towards the food. For what? To understand the type of feeling and culture they are following. So they will clearly explain, I don't want to kill any animals, or I don't want to kill any birds, they are also part of this nature, so I want to eat only plant-based food. But in my plate every day I'm seeing this so and so thing, so I couldn't eat. So it's really or literally disturbing me. So after eating that, I'm feeling a kind of taste in my mouth. So understand, assess the patient's perspectives and feelings towards eating food. And in implementation you write assess the patient's perspectives and culture. The patient is not allowed to take so and so food according to their culture, or patient is very cautious about the living animals. That's what they are not eating, only plant based food is preferred. So whatever that you can write under implementation. Then check and evaluate the environment which eating happens. That very important, where the eating happening. Some people will not be interested to eat in a crowded place, or in a dirty place, or in a what they will sell it. This is so, the food is like that, the food is clumsy, and the area also look like very dirty. So especially psychiatric patients have kind of feeling like OCD kind of feeling. So you have to understand and evaluate the environment for what to improve the interest to eat food. Then check the environment and plan the eating setup and environment based on the likes and dislikes of the patient. Then plan appropriate short-term goals to make the patients do it. So if you give long-term goal like eat this many meals, okay, or eat this much amount of food, or if you eat this, the next we can take for you for the next break or next kind activity. Like long-term goal if you give, sometimes the patient can't eat. Instead of that, if you plan short-term goals, if you eat, we will go out for a walk. If you eat, I can give you a cigarette. Or if you, I mean, if they have smoking session, especially in psychiatric hospitals, I'm telling. Or if you eat, we can go for a round. If you eat, we can I can make you to what sit alone for a while. Yeah, so short-term goals. If you plan short-term goals, definitely you can improve the patient's confidence. Okay, if I eat that, definitely I'll get this what particular thing which I like most. So the kind of short-term goals you have to set the short-term goals in implementation column. You can write. Then provide a pleasant and quiet environment. That's very important. Pleasant environment is very important to increase the intake and avoid distractions, and provided pleasant and quiet environment. Then practice good oral hygiene and dentition. That is very important. Studies are saying that good oral hygiene can improve the digestion, and we all know that if we have good oral hygiene, the mouth taste will be good. So that is a common sense, right? So started practice of good oral hygiene. Okay, depend upon the convenient of the patient, and this is another easy planning which you can implement. Thing is provide good companionship. Some patients maybe don't like to eat alone. They want someone to sit and talk, chit chat and eat. So in that stage, understand what type of eating, what companionship they like. Some, if they don't want to sit with crowd, just arrange in that way. So attention to the social perspectives of eating is important in hospital and home setting. Then provided good companionship. Find out the changes in sense of taste if not contraindicated. So sense of taste is very important, especially if they have hallucination or gustatory, olfactory hallucinations, means they will feel different taste. What type of hallucination they have, that you have to find out for. Okay, so if they have gustatory hallucinations or olfactory hallucinations or visual or tactile, what type of hallucination they have, you have to find out, and based on that sometimes they have different taste, and find out what type of taste they are feeling, and provide or change the flavor of food based on that. Found out the taste and sense of the patient, like that you can write in the implementation column. Then plan small nutrient dense meals instead of larger meals daily to avoid fullness. Eating small frequent meals lessen the feeling of fullness. Planned and started to provide small meals. So plan small meal, that is very important. If you plan like 5-6 meals, something the patient can't eat. So small meal, high calorie meal, that's very important. Then identify the time of day and when the patient appetite at peak, and highest calorie meal at that time. So when they, sometimes some patients will not feel to eat morning, so they don't eat anything. So if they are basically showing a self neglection, means completely they will avoid eating. So in that case, some interest they will show. That type of patient will show some interest during lunchtime or during 3 o'clock or 4 o'clock. So I find out that timing, and that time you give high calorie diet to them. So through that way you can improve the nutritional balance of the patient. So identify and started to give calorie meal. Like that you can write in the. Then encourage the family members to stay or bring food from home. This is optional. It depends upon the type of care home or hospital or place where you are working. It depends. Okay, so sometimes family is allowed, means it's not. Sometimes in some hospital outside food is not allowed. It depends. So I'm not going to discuss more about that thing. It depends. Then encourage exercise. That's very important to improve the metabolism, and started to do some exercise. Then identify the patient's feelings regarding the impact of lifestyle. So how these patient's feelings and how it impact their lifestyle. You should identify that, and you need to validate the patient's feeling. If you try to validate or respect the patient's feelings, automatically you can develop a what to promote a nurse patient relationship, and it will improve the interaction and interest of the patients towards you, and through that way you can improve the eating habit of the patient. And in planning column, validated patient's feeling. So this is about the planning, rational and implementation, and at last you have to write the evaluation. After doing all these things, what will happen? The patient started to consume adequate nutrition and maintain adequate weight. So this is the care plan which you can use for imbalanced nutritional status, less than body requirement related to self-care, neglect or refusal to eat food. Okay, so this care plan you can use for mental illness, those who have imbalanced nutrition, those who have depression, those who have anxiety, those who have schizophrenia, etc., and those who have any kind of emotional disturbances, those who have stress. So all these conditions you can use this care plan. If you understand, guys, thank you. Next week another video with another nursing care plan and diagnosis. Thank you.